We are moving now to Farah Al-Shami. She is the Social Protection Program Director at the Arab Reform Initiative, who is leading extensive work on analysis, policy, and advocacy in the field of social protection. Welcome, Farah. I think we mentioned already a few times in this session that humanitarian assistance has served as the main providers to support affected population in Lebanon. So the question for you is, what do you think that are the structural and institutional gaps in governance in Lebanon that should be addressed before or to allow this transition to a government-run system, to facilitate this transition? Over to you, Farah.
Thank you very much, Mireya. Thank you for having me, and it's a pleasure to be among you today. So indeed, Lebanon has for long dealt with what we call the humanitarianization of the social protection field. It's been relying on this patchwork of donor-funded, non-state programs that supposedly should only be there to provide life-saving support during crises, during shocks, during conflicts as a complementary element and not as the core social protection system. And these operate outside of formal state structures, in addition to being led by non-state actors and trans-state actors. Now, this reliance on those actors is due to the Lebanese government lack of political will to unlock its capacity to provide adequate social protection. So it's not because of its lack of capacity to avoid adequate and inclusive social protection. It's because of its lack of political will to unlock this capacity, which in my opinion, it has. But when we see all these reforms that we've been mentioning and the progress that has been made so far, when we see all this progress struggling to see the light, this is big proof that indeed there is resistance to such progressive reforms. And that is mainly due to the government's, in my opinion, to its political-economic structure that is characterized by clientelism. This is not to mention a cliched word, clientelism, but it's because the political class still deliberately chooses the charitable approach over anything else. And that is because the political class would like to be the main provider of social protection through their faith-based organizations, through their political parties, in order to increase their constituent space and to remain in power, in my opinion. And that's how they have been surviving on this political bargaining. Safety nets and even more humanitarian assistance can reproduce this at a micro level on the ground and can reproduce clientelism if they are not managed and governed the way that they should. And this is what we have been seeing. Now, the government has been, since then, evading its responsibility or trying to push some reforms to no avail, blaming this on its inability to finance, whereas we look at the financing scheme and we see that the financing priorities lie elsewhere. And it's not that the government is indeed not able to finance. The government blames it on institutional and administrative infrastructure or institutional capacity issues, which indeed we have, and I will touch on this shortly. Sometimes they also blame it on conflicts, shocks, crises. These are many. The country is barely getting the time to recover, and then another crisis happens, so we don't have the capacity. So they blame on this, but for me, it's a political choice, and that's why things are taking longer than they should, and reforms have been shy. It is about time to shift, in my opinion, from this logic of programs, of interventions, to the logic of systems, to be able to transition actually from the humanitarian aid system to a social assistance system that is state-led. And this transition starts by linking both systems together to begin with, and by working through integration as a process. If we think of integration as a process, not a commodity, not an outcome, okay, then this is how things can become more feasible, in my opinion. Now, there is a lot. Jules, you mentioned so many lessons learned. We have a lot of lessons learned, especially during the war, from alignment, from not creating parallel systems when not needed, from basically piggybacking on something, for example, how we piggybacked on the NPTP during the war to create the shock responsive social safety net, from vertical and horizontal expansion of the NDA, and others. We do have a lot to learn. But in my opinion, there are three important steps that make the priority as part of this desire to shift and of this desire to integrate both systems, because we are not there to cancel any system, but gradually when we integrate, we will see that the humanitarian field will be phasing out, as it will be indeed replaced by something, by preparedness, by availability of social protection a priori, so that humanitarian aid can play its role as a supplement or as a complement, as a complementary, element, indeed. So what are these three steps? Coordination, and this has been mentioned by both speakers before me, data and the fiscal gap, addressing the fiscal gap. Coordination, I mean, the key to move from vision to execution is coordination. And the coordination channels have been very informal, both within the humanitarian field itself and between this field and the social assistance field. During the war, we would see the coordination mechanisms like, for example, one meeting convened or hosted by the Minister of Social Affairs, back then, Minister Hector Hajjar, whereby we only had 12 organizations meeting. So this cannot be representation of the humanitarian field, cannot be considered effective coordination. And that was the most formal form. So we need to think of formalizing the coordination channel within the humanitarian field and between it and the social assistance field. The government needs to impose a mechanism through which it requires representation of humanitarian actors in front of it as a government. But more importantly, for this to happen, we need to start on the government side. We need to start with the prompt activation of the formal interagency, interministerial committee that everyone is talking about, that is chaired by MOSA, yes, but that also includes the technical secretariats on health, on education, on labor, and that is also able to incubate the different spaces that are available. I'm sure my colleague Diala Tonia will speak about the cash working group, about the social protection forum. So these spaces for humanitarian aid should also be integrated or incubated by this committee that has to be activated immediately as part of creating this unified and institutionalized front that I'm talking about. Now, the second very important element, in my opinion, is data. There is dire need to establish coordination protocols, but also collaboration protocols within the international and also the national humanitarian community, with a focus on data sharing. So there are so many layers to that, but in my opinion, data sharing should be put as top priority, because data has been one of the biggest obstacles that I mean, for reform in general. And we saw this during the war. And it's been treated, data has always been treated as an instrument of control, as a tool of control, instead of a tool for learning, for reform, etc. But here again, as we are doing this particular step, we need to start with addressing or tackling the fragmentation of the databases. Now we had progress integrating the registries of the ESSN and NPTP. Now we have one unified registry that is good on the poverty side, but we also, this registry, for example, should speak to the NDA registry, to the Rights and Access Programs registry. So we need to integrate all registries and create one unified national registry. And that should be, for me, an intermediary step, because the ultimate step, if we are to be more optimistic, is basically to move to the civil registry, to the unified identification number, which would allow access to social protection as a human right, and not as a charity, a service, aid, or a relief, for example, or at least the project that is now being discussed in terms of like reforming the social security law, which is to create a unified number with the social security fund. This could also help with the integration, or be used as a channel for this integration of data. And the registries need to also be dynamic, in my opinion. I mean, if they are dynamic, they can ensure preparedness, they can ensure shock responsiveness. And this is only when we can make sure that the integration of a humanitarian assistance becomes a continuum and not a like one-off, because it's a process, as I mentioned. So the shock responsiveness, the adaptability, the flexibility is all we need, or the dynamism in the registry. Now, the last point, and I'm going to keep it short because I think I went over time. It's the fiscal, sorry, Mireya, my habit. It's actually the fiscal gap. The financing question is big because this reliance on humanitarian actors, trans-state actors, is not only to evade responsibility, to delegate that role. It's also because the government keeps saying that it cannot finance internally social protection systems. However, I do know for a fact that we have this potential research so shows that. But we need to also move from the funding logic to the financing logic. We need to start thinking of progressive taxation, of wealth taxes, of other fiscal space strategies. There are many, I'm not going to enumerate them, to gradually move from this reliance on donor funding to the internal redistribution of wealth and public resources, and on preparedness and sustainability fiscally as well. And we have also success stories here to mention, like in the NDA. I mean, we moved to national co-financing in just 2 years. So it's not impossible when there is will to do it. So this is how, in my opinion, we can gradually also convince humanitarian actors or create a natural fertile space for the humanitarian actors to be able to channel their funds, whatever funds they have, to the government. I mean, we always see, it's like it goes without saying that development actors channel their funds to the government so that the government can provide a social safety net or can do a certain launch a new universal scheme. But we never see humanitarian actors do this, but at the same time, they are right not to do this. But if the government does the fiscal consolidation that it has to do and start relying on its internal resources to begin with, then this basically avant-gardist step can become more natural and fit for purpose, in my opinion. I'm going to stop here, and sorry again for going over time.
Thank you so much, Farah. I think that it's extremely interesting what you said.